Thank you both for being here today and for your help and support and the service that you both provide to mothers and others all around the state. Your service makes us all better, and I'm proud to stand with you. And I want to thank you all as well for joining us here today. I've traveled around Michigan throughout the last year as a candidate to be the next governor of this state, and at every single stop, from right here in Flint to Detroit to Traverse City to the city of Muskegon, I've heard stories about a healthcare system that fails people at their most vulnerable moment. So today I want to focus on one of the most urgent and heartbreaking manifestations of that failure: Black maternal health crisis here in Michigan. Right now, Black women in our state are nearly 3 times as likely to die from pregnancy-related causes than white women. 3 times. Between 2015 and 2019, the maternal mortality rate for Black women in Michigan was 29.8 deaths per 100,000 live births, compared to just 10.7 for white women. And when we break down preterm birth numbers by race, the disparity is stark. Nearly 15% of babies born to Black mothers are premature, compared to 9.5% of white mothers. These are our neighbors, our friends, our sisters, our daughters. They are babies who will never take their first steps, mothers who will never see their children grow up. And it's not just because Black women aren't seeking care, it's not because they're not doing anything wrong. Research shows that it doesn't matter if you have a college degree or not, health insurance or not, or a good paying job or not. You can still face the same devastating, unequal outcomes. This is about taking on and fixing a system where Black mothers aren't listened to, aren't believed when they say something's wrong with their bodies or their babies. Here in Flint, families are still dealing with the long-term health implications of the water crisis, a crisis that was allowed to happen in a majority Black city. Pregnant women and children were exposed to lead, which we know causes devastating lifelong health complications. And while the state of Michigan has taken some steps to provide health care coverage for those affected, the trauma of the betrayal of knowing your government chose to poison your water, that trauma lives in the bodies of Black mothers and babies here in Flint. As leaders in Michigan, we have a moral responsibility to fix this. As your next governor, I will treat and prioritize and address the Black maternal health care crisis with the urgency that it demands. And that's why we're here today. That's why I'm proud to have built a health care plan with input from communities here in Flint and all over Michigan that will address Black maternal health. It is a central piece for my vision of Michigan's healthy future. And it's rooted in 4 things: investing in culturally competent care so that Black mothers may receive care that understands and respects their lived experiences. 2, expanding Medicaid-covered doula and midwifery services to ensure support before, during, and after birth. 3rd, requiring mandatory bias and equity training for all maternal health providers to eliminate the disparities that cost lives. And expanding access to life-saving prenatal and postpartum care so that every Michigan mother, regardless of race or income, has the support that she needs. We have the evidence, but we also have the moral imperative to act. The stories I have heard across Michigan make this personal. As a mom and as a Secretary of State and aspiring governor, I think about the daughter I met on a morning run who told me that her father, a carpenter who paid into the system his entire life, died because a health insurance company denied him the care he needed after he had a heart attack. My dad did everything right, she said. He played by the rules, and when he needed help, no one would help him. The same system that failed her father is failing Black mothers here in Flint and all across our state right now. And as governor, I will do something about it. I will transform our state healthcare system to ensure that it works for every Michigander. We will expand access, strengthen Medicaid, invest in community-led programs, and dismantle the barriers that keep people from the care they so desperately need. And we'll make healthcare more accessible and more affordable to everyone in this state, because no mother should have to fear for her life when she goes into labor. No family should lose hope because of a preventable health outcome. And no community should continue to bear the burden of disparity without a fight from those in power. This is a moral issue. This is a health issue. And it's an issue that demands leadership committed to equity, justice, and dignity for all Michiganders. Thank you. And now I'm happy to take a few questions.
Anyone have a question?
How much will this cost?
This is about priority. It's about shifting costs to ensure that everyone has access to affordable care. So it's not so much about cost as about simply just ensuring that what right is right and what's done is done, and that these disparities are addressed.
But how are you going to do that?
Well, my healthcare plan talks about the importance of ensuring we are investing in access to healthcare for everyone. Whether it's Medicaid coverage or whether it's a healthcare affordability board, we're going to make sure it's about policies that will ensure healthcare is accessible to all.
But
Colton, anything for you today? Anything about Secretary Benson's affordability plan?
I guess could you walk us through the basics of the plan a bit more?
Sure. I mean, the pillars of this plan are about making sure everyone has access to affordable, high-quality health care no matter their zip code. It's about taking the policies we have and ensuring we're addressing inequities so that everyone has access to affordable care. There's a lot of proposals out there that have been out there to get us there, but we can't implement any good policies if the Michigan Department of Health and Human Services is inefficient and not actually achieving its goal. So the heart of our plan is actually making sure the policies of our healthcare service system, our Department of Health and Human Services, is actually emphasizing and prioritizing the needs that are going unmet right now. So our plan is about increasing the affordability of healthcare, ensuring access to care, and working with mothers, nurses, everyone all throughout the state to ensure that care is real.
Catherine, let's go to you.
Yeah,
Anything today?
just with what you were just saying about the Department of Health and Human Services, what concrete changes would be the first thing you would make?
Well, we talked a lot about the fact that right now there are obstacles being created to ensure people, or obstacles in place requiring duplicative applications and other things that are making it more difficult for people to get access to the benefits that are funded that they actually deserve. So one of the things we've talked about is ensuring the data we already have in the state will be utilized through an infrastructure so that so we use that data to determine people's eligibility as opposed to creating obstacles to make people reaffirm the eligibility that we already have the information to affirm for them. In addition to that, we want to make sure that, again, no matter where you live in the state, we're supporting access to care, especially in rural places, but also in underserved cities like Flint. And on top of that, we've made sure that we want to make sure that our Department of Health and Human Services is helping to address insurance denials by supporting individuals and patients who had insurance coverage denied, even though it's a doctor-prescribed need.
I guess how do programs like RX Kids fit into this plan?
RX Kids is a program that will ensure we have proactive support for new moms all around the state. And the support that's provided for moms here in Flint has clearly showed the benefits of that program for folks all around our state. So to me, the evidence, whether it's here in Flint or in other communities where RX Kids has been in place, this actually ensured that new moms have access to the support they need so that they can thrive. It should be available to every kid in the state, and that's why I've also put that in my affordability plan.
We have time for one more question. Anything for mid-Michigan now? No, you're good. We can go back to you, Steve.
This is kind of apples and oranges, but is there anything that you've been able to do in the Secretary of State's office and how you've worked on that office that is applicable to what you want to do in this particular area? Is there something you've done there that shows how you would accomplish what you want to do with this?
Well, as Secretary of State, I've taken our second largest agency next to Health and Human Services and transformed it. It was once a poster child for inefficiency. Long lines, moms with 5 kids sitting on floors waiting hours on end to simply renew their driver's license. What we've been able to do with no additional cost is streamline services, make things more accessible for folks, eliminate wait times, invest in mobile offices, take the money we're saving in duplicative services to actually invest in additional services like self-service stations and grocery stores across the state. My approach as Secretary of State and the Chief Motor Vehicle Officer of the state has been bringing government to the people, ensuring that we're meeting you where you are and providing you the support you need to either, in this case, get your license, or in what we're talking about today, get healthy. I'll do the same as governor to make sure every agency is as efficient and customer and service oriented as our office is.
And And that's all we have time for. Thanks so much, everybody.
Thanks, guys.
Thank you.